when we appreciate that stress precedes pain, that's where we can start to put the pieces or the clues together. So again, we can see from the literature that now we're starting to see that if you've had a previous injury, that impacts the likelihood of having another injury on the same limb. Okay, well, what about non-physical stressors as well? Okay, so the physical stressors, we know previous injuries, asymmetry and dorsiflexion, a lack of sleep. So again, when we sleep, the diaphragm and the pelvic floor are very, very active, obviously subconsciously while we sleep. So we want these tissues to be able to do their job. What happens when physical stresses happen? We start to avoid loading certain tissues, okay? So again, I think personally what happens when we go to touch your toes for a lot of people with back pain, if they're under a lot of stress and they can't retract the rib cage, or said another way, they can't lengthen the diaphragm, they can't contract the TVA, obliques, rectus abdominis, then we tend to see these strategies where they work around them, okay? And again, we'll cover that a lot with the toe touch. So what about non-physical stressors? Well, we can see from these papers, again, I'll give you the reference list of these papers, that people under chronic emotional stress or increased mental load, they alter their respiratory regulation in several ways, okay? So their breathing rate starts to increase, or their respiratory drive. That alters their breathing pattern and timing, which we'll talk a lot about today, and then the metabolic appropriateness of the respiratory response. So all that's saying basically is that people are sitting at desks at rest, and how their respiratory system is reacting is inappropriate for the demands that they're doing at the moment. So I like to say, you know, if someone's in extreme fight or flight while they're sat at a desk in pain all day, their respiratory system is acting as if there's a lion in the corner of the room about to come and attack them. Okay, they're in fight or flight, whereas actually what should be happening is they should be just quite relaxed. They should be able to go into rest and digest and fight or flight throughout the day. Okay, so again, that appropriateness for how the chemoreceptors are acting, it's not appropriate for a lot of people in this day and age. Increased respiratory drive means an increase of the body's readiness for action. Okay, said another way, a lot of people these days, they're struggling to relax. In order to relax, we need ribcage depression, we need the diaphragm to lengthen. Diaphragm lengthening goes in exhalation, goes into rest and digest, parasympathetic dominance. Okay, when we inhale, okay, sympathetic dominance. Okay, so we want people to be able to exhale, relax. Hyperarousal brought on by mental and emotional process computes the allostatic load and affects the capacity of the body to maintain its stability, respond to change. Okay, so again, we can't regenerate, we can't get out of this fight or flight. Anticipation of coming physical and emotional events is a distinct effect of increasing the respiratory rate, reducing the time of exhalation, and changing the respiratory pattern. Okay, so just like perceived threats that we talk about all the time in pain science, if we think about something that makes us nervous or stressing us, your breathing rate will naturally react as well. That situation hasn't happened, it's anticipation of this situation. So again, anticipation of going to lift something up, a lot of people are holding their breaths. When we hold our breath, we tighten the diaphragm, we stop the diaphragm from lengthening. Again, we're reinforcing that sympathetic dominance, okay? So the anticipation of coming activities is very, very important. Then what happens is the respiratory system is responding to emotions rather than metabolic cues. So again, rather than sat at your desk, you know, all day working, your respiratory system is responding to your emotions, okay? So again, that stressful situation, it's affecting the respiratory system, okay? But the cues in the chemoreceptors may not be aligned with the actual physical needs of the body or its metabolic requirements. That's very, very important to understand. When mental and emotional factors such as fear, grief, anxiety, or depression drive breathing regulation, homeostatic and biomechanical and inappropriate breathing during the anticipation of the action does not occur, okay? So all of these things such as grief, anxiety, depression, we need to understand, we need to have an awareness of in the subjective assessment, okay? So we need to be asking questions and actually looking at the person rather than just the symptoms, because if someone has any of these issues going on, there's a good chance that their respiratory system could be sensitized.